In pharmacy, we see the medications. We rarely see the clinical aspects, the chart of the patient, the lab work. We had a physician clinic that was open to collaboration. We're linked not only through communication and proximity, but also through software. So we obtain patient consent, and we were able to access their medical record through the physician office. We're already involved in their care, so it seemed seamless to add this other component to it. It saves time for the clinician involved.
The doctors are very busy, and you get your 15 minutes, and you don't get to ask a lot of questions. They just say, we take this and take this, but don't have time to explain why. Sukh sat down in his office here and just explained everything to me. And then when the other pharmacists came on, it was just a transfer over of knowledge, and I could talk to any of them. It's been great.
When you talk about the patient care, that's what actually he takes one step ahead. Just looking after their health, looking after the bigger picture of what that patient really needs.
I've always had a struggle having to deal with so much medication for diabetes and not knowing what it did for me. The drugstore made it very clear as to why I have to take those medications.
The reason why we do it and we enjoy doing it is because the patient benefits. There's no question about it. We're able to look at the whole picture, find other problems that someone else may not have been aware of, or even make suggestions that we think might better the patient's care. Andre, he's one of the physicians that we collaborate with. He thought it was great that pharmacy wanted to be involved in patient care, and he helped facilitate it.
Well, I think collaboration is kind of the core of who we are as humans. The ability to sustain healthcare depends on the ability of the individual to care for themselves, and in order to do that successfully, you need a team. It doesn't mean just a physician or just a pharmacist or just a nurse. It means breaking down these silos. That takes place over time, and it takes the village to work together.
What we find is that they value our input. They look to us for suggestions.
I rely on the pharmacy for advice and service. A number of times where things have been pointed out to me in my own medical record that I wasn't aware of by the pharmacy, or they've caught things or been able to institute things that advance the care of the patient.
We're very fortunate to be working with him. He's very forward-thinking and always open to having pharmacists involved in patient care. At the end, he understands that it's a team approach, and I feel like I'm a part of the clinic.
I just think this is what people want. I think, as a human, that's what I want, and I suspect this is just a natural thing people want. So we just have to find ways to stumble into the future.
As pharmacists, we feel like we're right there, part of that team. He's a good collaborator to be in collaboration with.